Okay, good to know. Let's see, no history of any strokes or seizures, is that correct?
Yeah.
Okay, alright. Not on any, like, chronic opioid pain medications?
Nope.
Okay, great. Let's see, how about tingling or numbness anywhere?
Well, I have carpal tunnel in my hand. I was diagnosed with carpal tunnel, so my hands, my fingertips are a little numb, but
Okay,
that's been
alright.
going on for years. Yeah.
Yeah, okay. Okay, it looks like you take medications for high blood pressure.
Yes.
Is that pretty well controlled on the medications you're taking?
Yep. My blood pressure's been really good.
Okay, good, good. No history of any heart problems, no heart attacks or heart failure, is that correct?
No heart problems.
Okay, no like arrhythmias, no pacemakers, anything like that?
No. Nope.
Okay, wonderful. All right, and then I think I saw in one of the notes you're able to walk a couple of blocks or a couple of flights of stairs without chest pain or shortness of breath?
Yeah, I could. It's just my hip keeps me from walking. I have a lot of hip pain, so that's what keeps me from
Gotcha.
walking.
Okay, all right, good to know. All right. It looks like I saw COPD in a problem list, but it didn't look like you're taking any medications for it. Is that
What is it called?
COPD?
Oh,
Lung disease from smoking?
no, I'm not taking any medications for it.
Okay, have you been diagnosed with just like mild COPD?
I
No.
wasn't aware of it, but I don't know. I wasn't aware
Okay.
that I was.
Are you a current smoker? Is that correct?
Uh, yeah, I am.
Okay. How long? How long have you been smoking for?
Well, I started in my 30s, and then I quit when I ended up in the hospital in Coos Bay with acute pancreatitis. I had ketoacidosis,
Okay.
and I ended up in the hospital. And I got out of the hospital. I quit smoking for a few months, and then I started back up about a month ago. But I'm slacking off, and my plan was to quit before surgery. But
Yeah. Okay. Well, we definitely recommend you do that. It's definitely better to quit. A good few weeks or months before surgery,
okay,
rather than just the day of. Yeah. Okay. All right. Any marijuana use?
no.
No. Okay. All right. How about obviously you have some arthritis in your hip? Any like history of like back or neck surgeries?
I have a lower back surgery. I have a neck. I got arthritis in my neck. Yeah, I have some neck problems.
Oh, okay. How's the range of motion in your neck?
It's fairly good. It's not 100%, but it's good.
Okay. Okay. All right. Good to know. All right. How about heartburn or reflux?
I have a periodic history of it, but I haven't had a problem with it in quite a while. So,
Okay. All right. Good to know. Sounds like you had some gastric or stomach ulcers at some point. Is that cleared up?
yes, yes.
Okay. All right. Good to know. All right. And then any kidney disease as far as we know?
I don't know if it was kidney stones. I had some kind of stones, but when I was in the hospital, but they said they were small, and
Yeah.
I can't remember if they were kidney stones or what they were. But
Okay. Sounds about right. Okay. Looks like you're taking medications for diabetes.
metformin, yes.
Okay. Is that pretty well controlled on
Yes,
the
my
meds you're taking?
A1C. I had my A1C check not very long ago, and it was 5.3.
Okay.
So I lost
Okay.
a lot of weight since I got out of the hospital because I haven't been eating sugar and stuff. So
Yeah. Okay. Good. Good for you. No thyroid issues as far as we know.
no,
Okay. No bleeding or bruising disorders as far as we know.
no,
Okay. And you're not taking any blood thinners.
no.
Okay. All right. Well, other than that, other than what we talked about, other things you know that I don't, other things that you're seeing a doctor for or taking medications for?
Uh, no, no.
Okay. All right. Well, good deal. We'll plan for anesthesia. So for these hip surgeries, we do a general anesthetic. So what that'll look like, you'll come in. They'll take you back to the. Can you hold on for just a second?
Okay.
Okay. Great. So, yeah, it'd be a general anesthetic. So what they'll do is bring you back to the bring you back to the pre-op area. You'll meet the pre-op nurse, operating room nurse, anesthesiologist. Your surgeon will come say hi to you. They'll get an IV placed. Once the room is ready, they'll take you to the operating room, get you moved over to the operating room bed, and they'll hook you up to a bunch of monitors so they can keep a close eye on you and keep you safe. They'll give you a mask that's hooked up to the anesthesia machine. They'll just have oxygen flowing, get your lungs nice and full of oxygen. Once your lungs are full of oxygen, they'll put some sleeping medication through that IV. You'll drift off to sleep. Once you're asleep, they're going to place a breathing tube in the back of your throat so that they can protect and maintain your airway while you're under general anesthesia. Anytime we put something where there wasn't something before, chance of damage to adjacent structures, what that means is chance of like nicks or cuts inside the mouth, chance of chipping or cracking teeth. Super unlikely for that to happen, but things I know could happen, so it's important to tell you. Then we'll get that breathing tube in secure, position for the procedure, and then our job as the anesthesiologist is just to stay right up there by your head, keep a really close eye on you, keep you safe, keep you asleep and comfortable. We do that as long as the surgeon needs us to. Once surgery's done, we'll start backing off on the anesthesia. We'll get that breathing tube pulled out when you're awake enough that you can protect your own airway, but before you're awake enough that you'll likely never remember having had it in. And then you'll wake up in the post-op area.
Okay.
Yeah, what questions can I answer for you?
I guess I don't really have any. It's basically the same thing as my last hip replacement, probably.
Yeah. Yeah, probably. Okay, well, if you don't have any further questions, we'll see you the day of the procedure, okay?
Thank you.
Alrighty, yes, sir. Have a good day.
Bye-bye.